Okay, well, thank you very much. Good morning, everyone. I'm Charlie French, sitting near Portsmouth, New Hampshire, where we all will be maybe in 4 years from now. Anyway, it's my pleasure to introduce our keynote speakers, our capnote speakers today. They're both with ESRI, or Esri, which is a geospatial technology company, and they're going to be presenting on how GIS is making a difference during COVID. Our speakers are Paul Rooney, and Paul is the state and local team lead with Esri, and much of his focus is on how public sector organizations can embrace change. And our other speaker is Andrew Makowicki, and he is a solutions engineer for local governments with Esri, and he has a wealth of international experience using geospatial technology. So without further ado, I want to turn it over to Andrew and Paul. Thank you so much. And I should note that Esri is a sponsor for this conference. We're very excited to have them. They're a bronze level sponsor. This partnership is great because so many of us use spatial technology, and many of us use Esri products. So it's a pleasure to have you here, and welcome. Thank you.
Thank you very much, Charlie. I appreciate the introduction, the nice words. It's great to be here with all of you folks. As Charlie said, my name is Paul Rooney. I've been with Esri since 1999 in a variety of different roles. And before I start, can you guys see my slides okay? It's part of the casualties of the Zoom era. It's like you got to always double check and make sure people are seeing things. So are we good?
We can see them.
Perfect. Good. Thank you very much. I am, well, I'm a couple of things. I am as I mentioned, we're with Esri. Our offices are up in the northern part of Massachusetts, north of Boston. We were just on our 3-minute breakout and had a nice conversation with Peter. And I apologize, I forget the other woman's name. She was delightful. She was from UNH, and we were talking about our interest in the beach and Crane Beach up in Ipswich. So it was, I think, Angela. If I got your name wrong, I apologize. Anyway, thank you all for inviting us to spend a little time with you today. We look forward to sharing with you how our company and our technology, Geographic Information Systems, is being leveraged by different organizations for COVID response and recovery. And it's nice to have kind of a lighthearted start. And I really enjoyed that lead-in session that we did. I haven't had an experience like that before. This is a pretty heavy topic, and we will try and give you what we hope is useful information that shares some experiences that our customers and folks similar to you are using as they deal with the pandemic. I'd like to start briefly by touching on 2 different statements. The first one comes from the NACDEP mission statement. Community resources and economic development extension professionals work with communities. I really like the definition of you guys as an organization and how you function. Supporting activities that encouraging broad participation and resulting in social, environmental, or economic improvements. I think of this as you serve locations or geographies and the communities that inhabit with them. I tend to put things into mapped or spatial form. The second quote is from Antonio Guterres, and he's the UN Secretary General. Recently, in the UN report on socioeconomic impacts of COVID, he said, quote, "We must tackle the devastating social and economic dimensions of this crisis with a focus on the most affected, women, older persons, youth, low-wage workers, small and medium enterprises, the informal sector, and vulnerable groups." I think of this as focusing on the needs of communities of people and the impacted places that are in need of help. It's how I translate your own statement of work about the things that you do and how GIS is being leveraged by organizations all across the world during this crisis. So my hope for the day is that we can share with you folks some ideas that you can bring back to your organizations, the communities of folks that you work with that are being impacted by this pandemic, both from a public health standpoint and from an economic development standpoint. Here is some sobering numbers as of last Friday: 6.2 million cases of COVID around the world with 380,000 deaths. And in the US, 1.8 million, almost 2 million cases and well over 100,000 deaths. So an enormous percentage of the global pandemic is occurring right here in the US. It's impossible yet to quantify the economic cost. That will play out over time and will be largely dependent on the steps that are being taken to mitigate the public health impact on the economic crisis. Add to this dimension the challenges that we are seeing just this past weekend and what this is doing to our society. And by this, I mean the whole range of tensions that we as people are dealing with these days. And again, it's a challenging discussion to have. Hopefully this will be useful for you. In April, the National Governors Association outlined 10 key steps and related operational considerations to guide the critical decision-making that they, as state executives, needed to put into place to support public health and the well-being in the weeks and months ahead in each of their states. Now, the governors identified 10 different recommendations, 5 that focus on public health infrastructure, and 5 that are designed to help reopen the economy safely. Excuse me one second. The early phases of the pandemic focused on response. GIS, the technology that Andrew and I work with, and some of you are familiar with, the users of that technology at all levels of government, the nonprofit, academic, and the private sector struggled early on to gain understanding, and as the demand for testing, surveillance, contact tracing, and protecting essential workers took center stage. Those terms have all become part of our common language now in ways that had never really been prior to the pandemic. We've learned a lot during the past 3 months, and much of what has been learned can be reused more quickly and effectively if we run into another surge situation. Now, as we reopen the economy, attention's being turned to how these same sorts of tools and the others that integrate with them can be used to ensure a safe and effective economic recovery. And we're going to be spending time demonstrating how our users and how your colleagues in different places have been leveraging GIS as a technology to address key issues in each of their communities. The COVID-19 system used by many organizations is integrated and also iterative. It supports each phase of response and is made up of solutions defined and refined by the requirements of our users. You'll be hearing a lot of stories about individual communities, whether they're cities or states today, defining needs that they had and then addressing them with technologies in different approaches. Here's some of the major components of work that we've seen. Understanding community risk. How are social distancing policies put into place based on the community risk in each individual community? What's the outbreak? What's the availability of resources? How are you measuring the effectiveness of social distancing? And are the policies that we're putting in place actually reducing that risk? How are we modeling spread and impact? Based on community risk and policies, what's the expected impacts on the healthcare system, on the ability for governments to deliver PPE and other important resources? How do we manage those resources, including the optimal allocation of testing and treatment sites? And sharing this information with the public. I mean, so much of what we're dealing with now has to do with anxiety and the unknown at the public level. Sharing information with the public so they understand risk, what they can do to reduce that risk, where they can go for testing and treatment. These components work in concert with each other as a single system, with the output of each of them serving oftentimes as input to the other components, much like an ecosystem. Here's another way of thinking about this. Organizations now are faced with 3 significant questions as we go into reopening. Number 1, how do we do it? How do we reopen in societies? How do we resume normal operations or more routine operations, mindful of new public health guidelines, new personal takes and personal responsibilities that we have in interacting with others? And how do we potentially handle reoccurrence in such a way as to protect our populations while getting our lives and our economies back on track? These are very complex problems, and in a significant way, They are all tied to location, right? And we'll see that over the course of the demo to come. So right now, I'd like to turn this over to Andrew, who will walk us through the stories of 3 different organizations, 1 city and 2 different states, who are using GIS to respond to the outbreak in their specific locations. Andrew?
Thank you, Paul. And thanks for the introduction, Charlie. Good morning, everyone. My name is Andrew Makwicki. I'm a solution engineer here at Esri, based out of the Boston regional office. Joined Esri back in October of 2019, so a fairly new employee, but excited to be here today. And as Paul had mentioned earlier, today we'll be reviewing the COVID-19 response and recovery efforts through material and real-world examples of organizations deploying Esri solutions and creating their own workflows and composites for information based on COVID-19 within their own communities. Our first demo will highlight resources pertaining to the COVID-19 response efforts, while our second demo later on in this presentation will cover the COVID-19 recovery efforts. And what you're seeing on my screen right now, can everyone see the COVID-19 GIS Hub? Awesome. So what you're seeing right now is Esri's Hub Site showcasing COVID-19 materials and solutions that we have curated along with work from other organizations and agencies. If you're not familiar with Hub, today you'll get a better understanding on how it is promoting transparency and empowering citizens to become aware and involved in the efforts enacted by organizations. Hub is a tool for developing websites and encompassing a one-stop shop for all of your spatial information and applications existing within your ArcGIS Online organization. Within an ArcGIS Online subscription, your organization could start using some of these solutions mentioned today through the deployment of a Hub website. All organizations within ArcGIS Online are provided with a basic version of Hub that users can use to develop public and internal facing websites. It's a place to organize, track, release, and expose spatial information while also promoting the awareness of events within the community. And I just want to first start out with the top banner for the Esri COVID-19 Overview Hub site. You see this Request GIS Assistance button, which ports the user to a page for our disaster response program. And what this program exists for is, in tumultuous times, organizations that are using Esri product can select this button, fill out their organization's information, and submit a request for a type of analysis or some sort of support that Esri can offer through the DRP. This could be something like increasing the amount of user roles within our ArcGIS Online organization. And for COVID-19, we've served a lot of DRP requests to help jumpstart organizations to get a better handle on the COVID-19 spatial data that they currently own. As we scroll down, you see the first application dashboard has containers that point users to operations dashboard about COVID-19 metrics at both the US national level and the global level. You'll see the first one is actually to the Johns Hopkins board that I'm sure a lot of you are aware of. But we also have index for US applications that when selected, the dashboard has all states, and then you can drill down into each state and look at different organizations and how they're handling not only the COVID-19 information, but also business impact and different resources pertaining to COVID-19. There's also a dashboard on the IHME COVID-19 projected peaks model at the state level. And what this is showing is the projection of when a peak will occur within a state. As you can see in Arizona, it's red, which means that, I'm selecting the whole country. Okay, here we go. In 35 days, they'll experience the peak COVID-19 confirmed cases. While in some place like New York, we could see that the peak was estimated 54 days ago. Now, this is all estimations based on known data, but they are estimates, and they have to be taken with some scrutiny. If we go down further, you can see that there's a little framework for how to handle your COVID-19 data, just walking through the steps of how to map and better explore your data, but also better visualizations for when the public is accessing this information through your own hub site. We also have more applications and dashboards showcasing things like travel restrictions and testing sites in the United States, which we'll look at deeper within different organizations and how they're deploying their testing site location information. And I also want to point out there are copious amount of open source data sets currently available for organizations to download and use within their own ArcGIS Online web maps and applications. And I want to point out one called SafeGraph Weekly Patterns Data. In the second demo, we're going to explore what this is and how it's being used and the usefulness of it as the economy starts to reopen. And finally, there are some featured story maps really tying together all of the data and information that might be compiled and can be shown in a fashionable manner that is both readable and deriving insights or showcasing insights, highlighting very important information on COVID-19. And so I'm going to point us to our first real-world example, which is the city of Fairfield, Ohio. They have deployed their own hub website based on the COVID-19 hub template, organizing all of their information on COVID-19 response within the city of Fairfield and also looking at the state level COVID-19 metrics. And you can see in the banner, they have some information on hyperlinks pointing you to different topics related to COVID-19, but also things like tax returns and information that the mayor's office has released. As we scroll down, you see that they would like to showcase the global confirmed cases of COVID-19, but they also have a dashboard of the city of Fairfield where they're showing all the zip code information on confirmed cases. So you can select a zip code and it will populate it with the confirmed case information. They have information on the state confirmed cases for Ohio. And then they also have a composition of local resources, everything from operations dashboards, compiling COVID-19 metrics, to documentation on different topics like recreation sites. And then finally, the last bit of their COVID-19 response hub is just information of a high-level overview on what COVID-19 is, some CDC information, and then local social media data that they have had fed into their COVID-19 response hub. I'm going to point you to Maryland's Department of Health organization and how they're handling the coronavirus disease in 2019. And what they're focused on in this hub website is really about testing, contact tracing, nursing home care cases, and frequently asked questions. So we're going to go through the testing category, but if you were to select something like contact tracing, it would just give you a brief example or information on what contact tracing is, how it might be used, and possibly if it will be used within the state of Maryland or by the Department of Health. So the Department of Health has showcased confirmed cases by county and then also by zip code. So giving it a more granular look at where the hotspots are for confirmed cases within Maryland. They also have metrics on hospital resources and then different demographic cuts on the COVID-19 cases. They have other graphics on positivity rate, deaths by date, and then also total reported cases, while giving a high-level overview of metrics of both testing and confirmed cases within the state of Maryland. They have a breakdown of summary statistics in tabular form, giving a bunch of different data cuts of COVID-19 statistics, a brief explanation on the background of COVID-19, how it spreads, what may be the symptoms, and then also COVID-19 Connect and frequently asked questions based on different topics of multiple questions they've had asked multiple times. So this is a real good compilation of all things COVID-19 testing and case-related metrics. Now, if we were to select the button testing, it would push us to a page off the main hub site on COVID-19 testing in Maryland. And what you see here are pins for COVID-19 testing locations. And if I were to, say, type in an address if I lived in Maryland, or if I were to drop a pin, I can use this slider bar to determine the distance threshold. And within that distance threshold, which is a straight line, what are the COVID-19 testing sites captured within that catchment? And what's the information about each location? So let's say I want to visit this CVS, I can select on it, get both the distance, the actual address of the business location, how to make an appointment, and then contact information about the testing facility at that location. There's a bit more information on symptoms, how to get a test in Maryland, and then also made all of the major sites updated on May 30th for COVID-19 testing within Maryland. Now, I'm going to point you to Florida, the state of Florida, which is also has deployed a testing hub site, but they're doing something a little bit different. Not only do they have in situ testing facilities, but they also have mobile testing lab. So their COVID-19 testing hub webpage showcases all of the counties and the mobile testing lab location and previously visited locations. They have a photo of the mobile testing lab, and then also some metrics on testing within the state. But not only that, they do have a dashboard similar to Maryland's where they show stationary testing locations. You can either type your address or select a location by dropping a pin, and then toggle the distance threshold to determine if there is a testing location within your region. You can select, let's say they've aggregated by drive-through or walk-up. I can select drive-through, select a location, and it will provide me information about testing within that site. And then they have some other metrics on COVID-19 testing. And what I've shown you in the 3 hub sites for both the city of Fairfield, Maryland, and Florida is that they're all working on a common goal to expose COVID-19 information in a fashionable manner. And what Hub is allowing them to do is really compile and collect all that information to showcase it on one web page that could be broken out into different topics for different page sites so that the public has a one-stop shop for accessing information. And the solutions that were deployed here were built by Esri, but they were influenced by actual workflows that organizations had already been working through, and we've just distilled it down so that they can deploy it in ArcGIS Online and tether all of their spatial data already existing in the organization to dashboards, web apps, and compile it all into a hub. And so to access these ArcGIS solutions, you would go to solutions.arcgis.com. And for the first one, I'm showcasing a coronavirus response, which offers dashboards, web applications that are tailored to COVID-19 metrics and data. And then finally, coronavirus testing sites solution, which would be tailored to testing sites, testing dashboards, and just information pertaining to any sort of testing for COVID-19 metrics. And with that, I'm going to pass it to Paul for the second half of the presentation.
Terrific. Thank you, Andrew. Let me get myself going here again, everybody. Let's see if we can't find me again here. Are you seeing my, what are we seeing on my end there?
Nothing yet, Paul.
Okay, hold on one second, please. Let's try. Let's do this. Apologies for this, folks. How about now?
Nope.
Nothing still. Okay. Share. Screen 2. Share that, and then all right, let's try.
There we go.
Yep,
What's
just got to
going on
put
now?
in presenter mode.
All right.
For the PowerPoint. Switch the screens.
Yep, hold on one second. You're all very patient. Thank you very much. I think we got it now.
Yep.
Well, that was an adventure. Thank you, everybody. And Andrew, thank you. I wanted to just hit on a couple of key points from the first demonstration. As Andrew alluded, we've been working with a range of different customers and folks like Fairfield, like Maryland, like Florida. And as we've talked about, they're addressing the challenges that they have and in ways that are most responsive towards their communities. In Fairfield's case, it was as a city, what can we be doing broadly to get information across to our constituencies? In the case of Maryland, at the state level, it's like, how are we understanding the spread of disease? How are we providing testing information? And in Florida, it was even more specific, given that they had mobile testing capabilities available to them. So they were leveraging different response tools, again, met their specific needs. Now what we'd like to do is to turn our attention to the reopening plans. And this, again, these are the 10 different criteria laid out by the governor's guides. Specifically, we want to focus on one of those 10, the developing and making available a strong, clear, and communication public engagement plan. These are very uncertain times, as we've been talking about, unlike any we've ever seen before. How communities leverage GIS to tell a clear, strong narrative around their status and their plans moving forward is incredibly important right now to clarify for the public expectations for engaging their own lives with their broader community. So our users are doing more of this work with targeted solutions that respond to specific needs. For example, assessing and mapping open businesses through a viewer like this community closures app, where to get medical services through a locator, and where to get testing, and then how to bring all this information into a dashboard. And I think one of the other byproducts of the Zoom era and the COVID era is the growth of and reliance on dashboarding capabilities to bring together a range of different information products into one environment. So what Andrew was showing you before were examples where our users are taking the tools that we build out and determining which metrics of information they want to be sharing. Okay, that's an important capability on their end, and doing so in ways that is pretty straightforward and easy for them to achieve. So the public health information that Andrew was showing before can now be combined with specific business information to give a more complete picture. We started this session really focusing on the need for understanding, and that our GIS community was struggling early on in this process to understand what the response needs are. Well, now what we're thinking is, how do we respond to the economic needs that our users are facing as well? So what's driving a lot of this is authoritative information. And this information comes from a range of different sources, including our customers, those that they interact with in their government organizations, Esri partners. We were talking about that with some of the data examples that Andrew showed off of our COVID site, and Esri itself. That source data combined with data collection, analysis, and visualization tools allows them to see their world differently. And as we'll see shortly, folks like the state of West Virginia have built and published surveys to track important information about how businesses have been impacted by COVID, and that information is combined with other data to create a more compelling picture. Each community has been impacted differently by COVID. Each has its own priorities and challenges and its own story. Maryland, as we saw, chose to focus on their public health response. As we'll see next, West Virginia and others leverage GIS to tell the story of their recovery plans. And with that, I'll turn it back to Andrew.
Thank you, Paul. Okay, everyone should be seeing my screen now. So our second demo takes a look at the recovery efforts surrounding COVID-19 and heavily focuses on solutions for reopening the economy, small business recovery, and organizational aid. We will jump right into it with the Esri Hub Site outlining a framework on how to slowly reopen an economy. Paul walked through these steps, and this Hub Site really drills down into specific detail with how Esri solutions are being deployed and enacted through the recovery framework. I think it is again important to reiterate that these solutions have been developed by Esri based on the commonality of workflows already being explored and produced by organizations. we have taken those workflows and distilled them down to solutions that can be deployed by a wide range of organizations. As we scroll down this hub page, there is one piece of information I would like to point out, as mentioned actually in the first demo, was SafeGraph's point of interest data set. And what this is showcasing is this is open source data currently for the pandemic, and it's based on business information for dwell times and foot traffic, looking at patterns of business visits. So this is a nationwide data set, and right now we're in Philadelphia. And the larger the symbol means the greater dwell time. And so you can see actually right here, there's some businesses or points of interest in a park, and that has a quite large symbol because parks have been open in certain regions of the country during the pandemic. You can also see that, for instance, restaurant and eating places have quite a high, or some locations are actually larger than others, which might give you information on how Philadelphia itself is reopening the economy. Then we can also tailor this so that we can join it back to COVID-19 hotspots and look at what businesses have been open and possibly if individuals have been exposed to regions that are of higher confirmed COVID-19 cases. So this data is accessed through the COVID-19 Overview Hub site in Esri and can be used to paint a better picture and a story of how recovery efforts are moving along as we go through phases of reopening within states. And so first we're going to look at West Virginia and their interaction with business recovery and communicating with businesses at the local level or at the county level actually. So they've deployed a COVID-19 business impact data hub that allows employers to access and fill out surveys pertaining to their business. And the first survey they have is business amended hours due to COVID-19 so that they can make aware to the public what businesses are open and their adjusted hours during this pandemic. But I want to explore the business impact survey, which when selected, take this survey button, it ports you to the survey 123 form that West Virginia has developed for employers to fill out information on both their business and the effects that COVID-19 has on both their business and their employees that they've either had on during the pandemic or had to lay off. So it's a copious amount of information that is being collected by West Virginia about their small businesses, and this is based on the county level. And so once an individual or employer fills out all of this information, it is then wired up to a business impact dashboard. Now, this is a publicly available dashboard, so anyone from West Virginia to New York or anywhere in the country can visit and get information on the current impact businesses have been exposed to based on COVID-19. And we can not only look at the statewide level of information on the certain metrics, but we can filter it by county by either selecting a dropdown, which we can search, or selecting this bar graph and looking at each county individually and how they've been affected or how the businesses within that county have been affected due to COVID-19. And we have a different amount of graphs, everything from revenue decline to potential closures, the types of industries in that county, the medical products available within that county, or the ability to transition to medical products that are necessary during this pandemic, and then also the ability to provide services, medical services, and respond to COVID-19, the COVID-19 effects. So this is really a dissolution of all the information, the tabular and numeric information that was submitted by employers and showcased in an easily readable dashboard. And so it's really just distilling information and making it presentable and helping to derive insights from the actual data. And I think it's important to note that there might be cases where a state has employers fill out very sensitive information that you wouldn't want to expose to the public. So you can have another dashboard that might be internally facing to the ArcGIS organization and only available to certain users that pertains to very sensitive information, which should be tracked maybe at a state level, but should not be available for the public to access. In this case, this public impact dashboard is public, and so citizens can visit this website and become more aware of the impacts that COVID-19 is having on businesses. I'm going to take you to the city of New Haven in Connecticut and their coronavirus recovery hub. And they've compiled a massive amount of information for their city. And not only that, but their hub site is available in multiple languages. So a lot of this information has been translated to serve communities where English might not be the natural tongue. So they've compiled everything from documentation to web apps and mapping applications. They have a message from their mayor, confirmed cases in New Haven, and some local resources. And we're going to drill down into these different pages off the main site. And the first one I want to point your direction to is the reopening of their city, the city of New Haven. They've focused on different phases for reopening the economy, so businesses are opening up at different times. But what they're really focusing on within this website and this page is outdoor dining, because restaurants have been affected heavily during COVID-19. They're generally the last ones that are going to be allowed to open up in many cities just because of the social interactions and social distancing, or trying to minimize social distancing is difficult within restaurants. So what they have proposed is outdoor dining, and what they're allowing restaurants to do is visit this website, this hub site, and actually apply for outdoor dining. So they would fill out this application, send it back to the city, and the city would either approve or deny the request to open up outdoor seating so that they can get the restaurant running sooner than when it would be if they were just an indoor sitting restaurant. And the city has also provided a web map application embedded in this website, this hub site, that showcases all of the restaurants that have outdoor seating. So a user can come here and visualize what restaurants are open and where they're located. Now, New Haven is also showing food resources within their hub site. So food accessibility can be difficult during COVID-19, especially in certain regions. And what the city of New Haven has offered is a food resources hub page that has a map application, which when selected, brings you to this web map of the city of New Haven and different types of food assistance resources. So the user can either type in their address or they can drop a pin and create a slide bar for a distance threshold. Let's say they don't own a car, so they're within a 1 mile distance, they want to see what's walkable. And what shows up is different types of food assistance resources that might be accessible from their location with a high walkability.
Andrew, this is Charlie. I just have just wanted to do a little quick warning. We have about a few minutes left, and I don't know if there's time for a couple of questions in the end. If that's
okay. Yeah, I'll wrap this up. I'm actually just finished. I'm going to hand it off to Paul.
Perfect. Thank you.
So what this is showcased is within the recovery and response, economic recovery, Esri has released solutions that help you distill down your data and make it more visible, copious amounts of information distilled down to meaningful insights. And once again, these solutions have been derived or developed through workflows that we have seen done by different organizations. You can reach this through solutions.arcgis.com. One of the solutions showcased today was a small business recovery with web maps and applications, and the other was recovery dashboards showing key metrics based on the data that you're available. So with that, I want to thank you, and I'm going to pass it back over to Paul for the closeout. Paul, you may be on mute.
Thanks, folks. Sorry about that. It's been that kind of morning so far. Let me see if we can't get our slide back up here for you and share, see what we've got, and try this. Okay, we got build partnerships.
Got presenter mode again, just
presenter mode again.
Display.
Okay, thank you. There we go.
Yep.
Okay, knowing that we're short on time, I'd like to make a request of each of you. I've been seeing some of the chat flow by. It seems like folks have got some interesting ideas. I've seen lots of chat about StoryCorps and other folks, and I think you're picking up on the idea that narrative is an incredibly important part of this process right now. So in our few remaining moments, I'd like to encourage you to do a few things if any of this has interested you. Number one is to read the National Governors Association Roadmap to Recovery. I'll attach the link to the slides afterwards, along with other links for things that we've seen this morning. Number two, and this is important, assess how your extension offices might partner with your local communities, states, and the private sector to make a difference by facilitating conversations of importance. Number three, reach out to your host university. Many of them are already existing GIS users with access to a range of technologies, including ours. They're also very much like small cities and have significant interests and challenges in reopening. Number four, learn about how your city, county, or state shares spatial information by contacting your state's GIS office. And we'll talk about that again briefly in just a second. And last, reach out to us with further questions if you have them. We'd really be glad to do all that we can to connect you with other interested groups. And I'd like to just emphasize this slide and this very last point from the NGA recommendations. It's all about building partnerships. And I think this has been an interesting session this morning. Again, we appreciate your time, but the scenarios we've been talking about today really require multiple levels of public and private and not-for-profit participation. In this case, we're seeing not-for-profit groups like the American Red Cross interacting with Walmart and FEMA and the states of Virginia and Maryland and the Census Department and the Army Corps. And I could see NACDEP, your host universities like UNH, interacting with some of the states in question here to bring the skills that you folks have to bear on this problem. This is as much a people problem as it is a technology problem, and facilitating these conversations and in driving action is a very, very important part of what's needed right now. Finally, I would like to, we'll send you the links in question. There's the link to the COVID portal that Andrew was hitting on before. The National State Geographic Information Council is the association of state GIS offices, so where you can find authoritative data in each of your individual states. A link for the Governors Association Roadmap, and finally for us as well. With that, I apologize for the technical glitches on my end. Thank you, Andrew, for the demonstrations. Thank you all for allowing us the time. If you've got a few minutes, I'd be happy to address any questions or take away actions that we could have and get back to you. But this is my contact info. We'd be thrilled to talk with you guys further.
Charlie, first, thank you. Charlie, could we call in audible? And we know some people have to jump to get ready to start a presentation in about 10 or 11, 12 minutes. At 11:30, we're going to have concurrent sessions, but there's no reason we can't keep this open for anyone who would like to stay and ask a few questions. Is that okay, Charlie?
Certainly, and I recorded some of the questions, and Paul and Andrew, you may have as well. And I saved the chat, so some of the questions that we don't address today, we can share with folks and maybe get back to folks.
Sure.
So Paul and Andrew, a question here is, how is valuable information getting shared to places that have limited broadband access or poor cellular service?
That is probably one of the biggest challenges. And I think the answer to that is, in many ways, it's not being shared. And it's certainly one of the biggest challenges that states are facing when they think about their own broadband networks and access points. I know that some of the funding that's coming out of the CARES Act is being targeted towards greater broadband access, but I think the short answer is this is a challenge. Some of the solution comes to collaboration between levels of government, where while it doesn't specifically address the local access, you have collaborations between states or regional governments and their local constituencies or partners or collaborators, where some of those questions that are driving local responses can be fielded by collaborators at different levels of government, and the results of that being kind of shared in other, maybe less technology specific ways. But this is a big problem.
Perfect. Another question from Nancy. There's a concern about receiving too much information. And so what's the most important or perhaps effective way of conveying information using a dashboard, particularly for phones, handhelds, tablets, etc.?
That's a great question. One of the means that Esri has made available to folks that are using our technology is to be device specific. So you can build a dashboard that is able to recognize the nature of the format of the device that you're seeing it on and optimize its screen real estate for doing that. That's something that we do for many of our applications that are delivered over the web. I think in the case of dashboards as a whole or information that's being geared towards the public, our advice has always been less can be more, right? And that it's very easy to get very busy and with information. And I think it can often constitute a real challenge for folks to digest information. One of the things that we've been doing over the last several years as a company is frankly to be able to deliver smaller, lighter weight applications that still leverage an organization's authoritative information. So, you know, Charlie, you and I go out into the field collecting information about businesses. We send it back to Andrew to build into a tool that could be shared with the other folks on the phone. And that tool is really ideally geared towards, you know, a couple of targeted functions versus, you know, one massive viewer that contains all sorts of information. It's hard to know how to approach it.
Perfect. And I'll ask one more, just I want to be respectful of folks' time to transition to the next session. This is from John Torak at Penn State. And it sort of relates to how do you weave in the story and the narrative. How do you intertwine connections and relationships with data-heavy, albeit useful tools to enlighten those connections and enable exploration?
Yeah, that's another great question. I don't know. I'm hoping that there are folks on the call who may be familiar with story maps, and I'm seeing a nod out of you, Charlie. That's great. The story map format really was introduced by Esri several years ago through the work of Alan Carroll, who had been over at the National Geographic Society. He was their lead cartographer. He came to Esri. He built really a line of our technology that incorporates maps with narrative and a narrative building experience to the point now where there are literally tens and thousands of story maps that are available to folks, including templates to deliver these narratives in different ways. So I'll add the story maps link to the other links that are part of this presentation. I would really encourage you folks to experiment with them. They're easy to stand up, and they include interactive mapping applications embedded within them. So it's the story and then the ability to go deeper into the particulars of it through the components that are incorporated in.
And we're certainly using story maps here at UNH to convey stories about the impacts of our work, to share information about food access and things like that. So it's a very useful tool. Well, I want to thank you both, Paul and Andrew, for taking the time to present to us today. This has been a great presentation. And I'll share the chat log with you if there's some questions on there that folks there are a couple that we didn't get to answer. But really appreciate your time, and hope that all folks get to take advantage of the tools that geospatial technology provides. So thank you again. And
yeah, Charlie, thank you, and thank you to all the folks at NACDEP and for inviting us today. I hope you have a great rest of your conference. If there's anything further that we can do with you in future years, I know you moved this around from place to place. So please keep us in mind for the future if we can engage you in subsequent years. But thank you very much. And if you've got any further questions, please let us know.
Perfect. And will you share the presentation with us? Can we share
Sure
that
will.
on the website?
Yeah,
Perfect.
if it's okay, Charlie, I'll just send it to you. Would that be okay?
Yeah. Great.
Very good.
Excellent. Well,
Okay.
thank you again.
Great.
And
Thanks,
Thanks,
everyone.
folks.
have a great
Take
day.
care.
We'll see you all in a bit.
Take care.